Hello everybody, and welcome to the Thursday edition of Video Clips. According to recently issued recommendations from the American College of Obstetrics and Gynecologists, the best thing to do for women in labor is usually, drum roll here, nothing. Leave them alone. Unless there's something clearly wrong, let nature take its course, the guidelines say. This seems like common sense. You only offer treatment and intervention for people who require it, but it's not the way that medicine is generally practiced and not the way that hospital deliveries are usually handled. In fact, articles have been appearing in medical journals for many years about too much intervention during childbirth. One article published in 2013 said that while the development of interventions in maternity care had reduced both maternal and infant mortality, quote, routine use without valid indications can transform childbirth from a normal physiologic process and family life event into a medical or surgical procedure. Adding, every intervention presents the possibility of untoward effects and additional risks that engender the need for more interventions with their own inherent risks. The group advised that health professionals should promote natural childbirth and, quote, advocate for policies that focus on ensuring informed consent and alternative choices, and caregivers should remember to first do no harm. I mean, it sounds like something I could have written. And again, just like Tuesday's video clips, we return again to the patients should be given informed documents to look at and make informed choices. The new recommendations heed this advice, stating that OB-GYNs should work with, quote, midwives, nurses, patients, and those who support them in labor, and, quote, help women meet their goals for labor and birth by using techniques that are associated with minimal interventions and high rates of patient satisfaction, end of quote. So I'll give you just a list of some of the specific things. If you're pregnant or you know somebody who is, this is good information to know. Alternatives to drugs can be used for pain relief. Going to the hospital can be delayed for women who are at low risk. That's one of the benefits of having a midwife or a doula, is often people stay home, women stay home longer before they go to the hospital, so they don't get the pressure to, let's go ahead and induce labor and that sort of thing. Common obstetric practices during delivery are of, quote, limited or uncertain benefit for low-risk women. No evidence to support routine fetal heart rate monitoring for women. This is a lot of the stuff that's done when you go to the hospital earlier than you should, by the way. No evidence to support routine breaking of membranes during normally progressing labor. No evidence to support routine amniotomy. Drinking water instead of IV fluids is not contraindicated and does not lead to negative outcomes. The opinion doesn't recommend allowing meals, but does say that perhaps snacks should be allowed and that this topic should be taken up at a future time. So this idea that it's dangerous to drink water or eat anything while you're in labor, particularly if you're going to be there for a long time, is really silly. First-time moms who've received an epidural don't need to have to be put on a time lane and may, quote, be offered a period of rest for 1 to 2 hours before initiating pushing upwards. And last, women are advised that they can spontaneously push instead of being told to do so at times dictated by delivery staff. It's also okay not to push as soon as the baby's head is descended. In summary, the recommendations state, obstetrician, gynecologists, and other obstetric care providers should be familiar with and consider using low interventional approaches for the intrapartum management of low-risk women in spontaneous labor. In other words, leave these poor women alone and let them have their babies, for crying out loud. Now, will these guidelines be followed? Well, my contention is the guidelines are never followed. Doctors don't read guidelines. The problems start with the advice to work with midwives. Nebraska has a bill pending that would allow certified nurse midwives to practice without a requirement to be supervised by physicians. The American Medical Association opposes this bill. While certified nurse midwives can practice legally in all 50 states, certified midwives and certified professional midwives cannot. There are 20 states, plus Washington, D.C., Puerto Rico, and Guam, in which certified professional midwives are not authorized to practice, and in these areas, these CPMs run the risk of being prosecuted criminally if they help with childbirth. Many women choose to birth their children at home, a practice that the AMA remains strongly against, even though for low-risk women, home births attended by registered midwives are safer than delivery in hospitals. Research actually shows that, and I have a study cited here. It seems that the medical profession is dead set against many safe and preferred practices and aggressively protects its turf in trying to prevent any other provider from delivering babies. Women giving birth are in the same quandary as people interacting with the medical system for all kinds of reasons. Guidelines often call for approaches to care that are different than those offered, and personal preferences are generally ignored. So one of the rules if you're going to hang out with doctors and go to hospitals, and sometimes we have to do that, is you have to learn to speak up. This is not a time to be meek and to obey orders. All right, let's go on to another topic that is infuriating. And I'll just start by saying, while I acknowledge that we have to have some government, I'm vociferously opposed to the growing influence of government in our lives. America was founded on the principle of limited and very decentralized government, yet every year it seems that there are more ways in which legislatures and government and officials and agencies seem to, quote, know best and want to tell us what to do. Americans have become very apathetic, and they complain all the time about the laws that are being passed and the taxes and this and that, but they don't preserve their rights by voting overreaching politicians out of office. I mean, there was a time when politicians used to worry about not being reelected. They don't worry about that anymore. Most of them are shoo-ins. Now, an example of government overreach happened in California concerning vaccines. The California State Legislature passed Senate Bill 277 in 2014 in response to the measles outbreak at Disneyland, ignoring the fact that most of the kids who developed measles had been vaccinated. The bill eliminated personal belief exemptions, or PBEs, for mandatory vaccinations. Many people who live in California complain about the mandate. I know of several people who had actually thought they might move to California and then decided not to do it based on this mandate. Yet the folks who voted for this awful law, for the most part, they're all in office. Not good, but and we have to do something about that. We cannot let these people stay there and complain about what they do. But it does appear that many California parents and some physicians are fighting back against the mandate. The law gave physicians more latitude in issuing medical exemptions for vaccines. While it has traditionally been difficult to find doctors to grant these exemptions, it seems that California docs are stepping up to the plate to help parents prevent their kids from harm. According to an article in the Journal of the American Medical Association, the number of California school kids with PBEs has dropped by 75%, while the percentage of kids with medical exemptions has tripled. The authors of the article wrote that this suggests that, quote, some vaccine-hesitant parents may have successfully located physicians willing to exercise the broader discretion provided in SB 277 for granting medical exemptions. SB 277 allows any child who entered kindergarten before 2016 under a PBE to continue to use it until 7th grade. The authors expressed concern that this, combined with the cooperating doctors and the unexpected numbers of exemptions, may mean that in some areas children will remain vulnerable to disease outbreaks. They seem to just continue to ignore the fact that the disease outbreaks are in vaccinated people, fully vaccinated, both children and adults. So congratulations to California parents for finding ways around this onerous and intrusive law, and a special thank you to California doctors who have the courage to stand up for these kids. Telling the truth and doing the right thing are both risky practices, and they can lead to many things ranging from threats of harm to losing one's medical license. The ultimate solution to this problem, however, has yet to be implemented, and it's to vote out the people who passed this bill and replace them with people who respect personal freedom. We have to throw the people out. I think I've mentioned this before on this channel, that in some previous videos, that in one election year, there were 146 members of Congress, federal Congress, who ran unopposed. Nobody even ran for election against them. This is despicable, particularly when they do despicable things. If I have my way, I get rid of all of them, start all over again. I guess that's not really practical, but I do pay a lot of attention to what my elected officials here do, and I let them know when I'm not happy. And we should let them know by not voting for them if we're collectively not happy. All right, that's all for today, as usual, and for the week, by the way. As usual, pass this on to anybody who you think might enjoy watching it, and I'll be back to you next week with more news.